Hello, I am Nitin Deshpande, CEO of Global Products LLC. We are a software company with the focus on healthcare IT software products. I am an alumni of Indian Statistical Institute, Kolkata, where I did my master's, and then an MBA from Southern New Hampshire University, USA. I worked in Tata Consultancy Services for a long time and was their country manager in Malaysia, where I started their office and structured a joint venture of TCS with a large local business house. I started a company iPractice LLC in 2008 to work with my partner company CMG Sindran Berhad of Malaysia, which is headed by my longtime friend Thedkar Yong, who worked with me in Malaysia. The objective of this partnership was to bid for large government projects to develop hospital systems for government hospital in Malaysia. We won the bid to develop the pharmacy and hospital system for Malaysian government hospitals. I set up an offshore team of 60 software engineers in Pune, India. The PHIS product, which was developed for the Malaysian hospitals, is now successfully implemented in Malaysia and is exclusively made in India. After successfully implementing PHIS in about 600 hospitals and gaining considerable domain expertise in healthcare IT systems, I started the company Global Products LLC with a focus only on software products, and that too for healthcare IT. Initially, I developed an electronic medical record system which was based on the requirements given by the US government for the US for the US doctors, and as this was mandated by USA to have all the doctors implement electronic medical record systems. So this was ONC 2014 certified. Subsequently, when we moved the system for marketing in India, we realized that the Indian environment required a lot of changes. I mean, the requirements in USA and India had some major changes in terms of the process, as well as the requirements based on the doctor's need to process volumes of patients. And so we customized this software extensively for the Indian environment, and we have now some early adopters. Then we also developed a home care system that was primarily for the US market, where home care business is a large business because of the growing number of baby boomers retiring. After that, I developed a system, Digital Clinic. The need for this system was realized when I was visiting South Africa and Malaysia with the US Trade Organization and talking about electronic medical record systems, where the people told me that the need in that country, in those countries, is to provide medical services in remote areas. In those countries, Malaysia and South Africa, the remote population has to travel considerable distance to reach the office even before getting a medical treatment. So we designed this digital clinic where the medical devices such as EKG, oximeter, the blood pressure monitor, the glucometer, the thermometer could be connected to our electronic medical records through Bluetooth. And these systems could be in the remote areas where not the doctors but the nurses or the medical assistants could operate these systems and send the medical records to the hospitals which are located further away. And if required, the patient could be moved to the hospital, or we could give a telemedicine or a video medicine consultation to the patient, so the patient doesn't have to travel all the way to the hospital. And incidentally, this system was shortlisted for Pune Smart City project by McKinsey for even a remote population in India. The fourth system we developed was the hospital inventory and supply chain system. Primarily, the need for this system was to help clinics keep track of the inventory and reduce the cost of holding drugs which are expired or which are recalled. The system would enable the doctors to maintain the inventory of the medical equipment and the drugs in the clinics, and we have connected the system to scanners so that scanning the product label, the expiry date can be captured, and the batch number also can be captured using scanner, so that if the drug is expired, the doctors would get the expired drug list reports would be generated, and using the batch code which are captured, any recall drug could be identified and can be sent back to the pharmaceutical company. So these are the four products that we have developed. The four products cover a market space of $90 billion globally. So there is a large demand for this system, and healthcare has been a priority in several countries. As the countries develop, more and more governments are focusing on healthcare, and I'm sure the demand for these systems would grow as more and more countries adopt healthcare as their priority for the citizens. At this stage, I've been joined by my cousin Amit, who is a chemical engineer, and Nanda Kishore, who is a senior software professional from iPractice, the earlier the company which I had started, and they are my team members in this venture. I have started marketing campaign in India using internet and social media, and sending emails to the doctors. We have got a very good response. The doctors have asked for demonstration, and I've given their inputs on our system, which we have used to customize it and make it more and more for the Indian environment and the requirement. So now we have the product which is considerably customized for the Indian environment and which is based on the latest technology. We are now seeking investment from investors who can invest in our venture so that we can fund our sales and support organization in India. We are thinking of having sales and support professionals in the metros who can follow up. The salespeople can follow up on the leads generated by our marketing initiative, and the support people would be there to support the product. Support is a major concern among the doctors who have purchased systems from Australia or US and installed it at their clinic. They are in real need of support, and when they don't get the support, they are pretty much not happy with what they have, even if they have paid a lot of money for that. I therefore invite angel investors to invest in our venture, and I'm sure the venture would be profitable and mutually beneficial. And our long-term vision is to have, after 5 years, an IPO. And I'm sure with the long-term partnership with the angel investors would have with us, they can reap the benefit from the profit generated over the years, as well as the IPO that we envisage that we would have after 5 years. So therefore, I invite the angel investors to invest in our venture. Thank you and goodbye.